I'm Mrs. Manjusha Kelkar, founder of Breakthrough Higher Education. As all of you know, that today we are interviewing Dr. Bruce Silver. Now, when I say that he is having a huge amount of experience, that means I want to say that almost 50 years of experience is in this field. And what do we do through Breakthrough Higher Education is that we mentor students who are willing to go to medical education field by just telling them what it takes to become a doctor, what are the skill sets, what are the attributes, and how the life is out there. So hopefully our viewers will get a great insights when we talk to Dr. Bruce Willis. So without any further delay, let me call Dr. Bruce Willis, who is, for us, he was kind enough to get up so early because it's good evening to India and good morning to USA. So good morning, Dr. Bruce.
Good morning.
Good morning. So it was so kind of you to come here and on the platform. See, we understand that when we are talking about the field of medicine, it's a noble profession. But having said that, nowadays sometimes we feel that in this field, people or doctors are becoming either impatient or they are losing out the empathy. So we would like to interview you, or we would like to talk to you, and we would like to understand how was your journey, your personal journey in this particular field. So yes, starting with the question, tell me something about yourself.
Okay, so as you mentioned, it's been 50 years since I started medical school. I started medical school in 1970, finished in 1974 in the East Coast of the United States in Philadelphia. And then went on to practice medicine. I did inpatient, outpatient medicine, nursing home medicine. I taught medicine for just about 40 or 50 years, about 40 years. And then as life evolves, I left the East Coast to come out to the West Coast of the United States, to California. I went to the West Coast not because I was seeking professional change, but rather my grandchildren were in the West Coast of California. And after 40 years of practicing medicine on the East Coast in the same hospital, the same medical school, where I was chief of geriatrics at that school facility, I decided that the most important thing to me was my grandchildren, and decided that I would come and be near them 7 years ago. And I've been very happy with those grandchildren, of course, and my children as well. But you got to have children to have grandchildren, I guess. Anyway.
True, very true, very true. Very
grandchildren
true.
are the important part. But having said
Yes.
that, I came out to California and reestablished a new practice of medicine here on the West Coast. And that's how I met you. So that was, that's pretty much my life in about 6 sentences.
True. Great. Doc, at one point of time when we are studying, what was that moment in your life when you just was a wow moment, or a moment when you decided that medicine is your calling? Because people out there, we try out many professions, whether we like this or that, or so what was the process, if you wish to, and when was that moment?
Very few people ask that, but there's a very specific moment, day or two, and that was when I was in high school. As the end of high school, I was very much science minded.
Mhm.
and I really liked mathematics and thought I would go to college and become a mathematician. And in fact, um, I had been accepted at college and I was going to go to college and major in mathematics, I thought, and do that. And
Mhm.
that summer between high school and college, I got a job because I had to do something. So I got a job selling ice cream from a truck. So I
Oh,
drove a
yes.
truck and sold ice cream to children,
Hmm.
people off the truck
Hmm.
over the summer.
Hmm.
And I realized that I really liked interacting with people.
Mhm.
And I didn't think that being a mathematician and studying math and formulas and discovering new things was enough for me, that I wanted that daily interaction with people on a more personal basis. And so selling ice cream from a truck is what convinced me to switch and go into medicine before, just a month or two before I started college. And I decided that's what I would do.
Oh,
So
great.
silly, but that's where it was.
Great. So that was a deciding moment, maybe, when you realize that you are a people's person. You love interacting with people, and what a better profession than be going into medicine to interact with people. So that was a very noble decision from your end. So tell me something about you did your major. After that, you took your pre med. I hope because
Yes.
you wanted now to do your medicine. And more or less, the journey was the same, which right now is in place, or was there any difference when you were studying? Like
Was there
did your
diff-
BS, then you did your MD, and then you proceeded for your residency.
Well, my life was really colored and changed by one person who is now my wife. But
Mhm.
I've known her since we were 12 years old. And we've gone out, dated since we were 14 and 15 years old.
Mhm.
And when I got to college, I realized that what I really wanted to do was get married and have children. Back then, I didn't realize how good grandchildren were, so I figured I'd have children first. Um, and so I was driven not only in one path to get my MD and practice medicine, but in another path to get married and spend the rest of my life with this woman. Um, and essentially went to college and decided that I was going to get through as soon as possible. So I finished my 4 years of college in 2 years by taking extra courses and doing a whole lot of things, and then left and went to medical school. Finished medical school in the 4 years, and then went out to do an internship residency program at a hospital, and found that that hospital was about perfect for me, and stayed at that hospital from 1974 to 2014, 40 years. I was at one point one of the youngest people on staff, and at one
Hmm.
point almost a senior citizen. So that kind of
Yes, yes, yes,
the
yes, yes.
journey.
Journey. So, Doc, yesterday when we were talking, you told that you were 21 and your wife was 20 when you got married. So,
Yeah,
on
that's
a
true.
family path, did it some way it came in between your studies, or she was the biggest support pillar for you out there?
Well, she was always my biggest support, always. When I came home and had discouraging days, and you do have discouraging days, as discouraging days as you may have, I think, in any business. I can't imagine how anything could be more discouraging than thinking thinking that you made a mistake, and thinking that maybe what you did
Hmm.
was, in looking back, the wrong path, and somebody was injured or hurt because of
Hmm.
something you did. Because although we're doctors, we're still human beings, and no
Yes.
human being is perfect. And when you have to
Hmm.
make a decision that is frequently either a life and death decision or a loss of limb decision, and you make a decision which is, in retrospect, wrong. You can go one way, you can go the other. Even if it's 50-50, you're going to
Hmm.
be wrong. And if it's
Yes.
95% right, if you can be
Hmm.
95% right on an
Hmm.
examination, that's
Hmm.
very good. If
Yeah.
you could be 95% in medicine, that's not good because
True.
somebody's going to get hurt.
Hmm.
95% is not the threshold. And yet some things can go one way or the other. No, you don't
Yes.
know because all people are different. Having said that, when not the times that are good, the times that are good, anybody can be your friend. But when the
Hmm.
times that are bad and you come
Hmm.
home and you have that support from
Hmm.
your significant other, as well
Hmm.
as if you have any from your children,
Hmm.
and children support you in different ways. I remember a very bad day I had when I was my second year in practice. And I came home and I was very upset with something that had happened at the hospital to someone.
Hmm.
And I came home and my 1 year old son was there and he didn't seem to care about that. All he
True.
cared about was dad was home and
But
he was going to give me a hug. And you know what? That was what I needed then. I didn't
yeah.
need somebody to analyze the medicine. I needed somebody to put their arms around me and give me a hug. Now, my wife was there too, and my son, and they were both very, very supportive. And that support system is invaluable, I think, to mentally continue on. The highs are very high, the good things are very good, and the
Hmm.
lows are very low.
Yeah.
So you have to deal with those emotions in your heart.
So, to keep you balanced, family support is very important in anyone's life out there when you are performing, be it a business or something. But yes, it is very important in the field of medicine because you are dealing with a human life. If something goes wrong in front of a machine, you can just always repair it. But with a human life, there is no second chance. That's what I understood with the conversation. So that was a very correct thing to say that 95% is not enough in the field of medicine. So yes, great insights, Doc. So what happened, and how was your journey, or how was your experience when you were having a teaching position also, as well you were practicing. So how are these two things different or similar? Means point of differences and point of similarities. How does it help when a practicing doctor comes and teaches you? With respect to a completely academic doctor. So just throw some light on that.
So can you say that again? I'm sorry, I missed part of that.
Yeah,
It
yeah.
broke up.
I was just trying to ask you how. What is the difference, or is it how? What is the impact when a practicing doctor who is practicing medicine out there, who is having his own practice as well, and comes and teaches you in the classroom, as against a completely academic person who doesn't have a practice but still comes and teaches you or tells you something? How different is
Yeah.
that?
Oh, it's so different. There's this great thought when I was younger that if I had my own practice, I would run it. I would own
Hmm.
everything. I would
Hmm.
control everything. And
Hmm.
so it was as if I had two jobs. I had two other physicians I worked with, and it was as if I had two jobs. One was running a business because
Hmm.
here in the United States, if you're going to run a medical practice, it's a business. You have to
Hmm.
make a living. You have to pay your staff,
Hmm.
nurses, receptionists,
Hmm.
rent. So you've got to pay your bills, which means you've got to
Hmm.
sit down and analyze the bills, make sure they're right.
Hmm.
You've got to hire people. You have to know how to hire people. In medical school, they don't teach you business. So how do you know how to hire the right person?
Hmm.
You have to look at the right person working for you. And among other things, make sure that person isn't stealing from you. You don't want an
True.
employee to steal from you. It
Mhm.
happens.
Yes.
It
Yeah, it
happens.
happens.
Okay.
Hmm. Everyone is human. Yeah. Hmm.
You have to deal with bad weather. If you
Hmm.
have bad weather, what do you do with your employees? How do you
Hmm.
get the phones to run? How do you
Hmm.
learn how to have the phone company put a phone into your office? They don't
Hmm.
teach you that in medical school. So that's
Hmm.
one job. The other
Hmm.
job is seeing patients, and you've got to go in
Hmm.
and see the patients and be available. So that was
Hmm.
two jobs. And
Hmm.
that second job, the business of medicine, was all encompassing. And I ended up running a 250 doctor practice eventually for 5 years, which had about 1,000 employees. But in order to
Hmm.
do that, I had to leave the practice of medicine all but a couple hours a day because
Hmm.
that became full time. And I did that for 5 years. And the first year or two, I was pretty happy with that.
Hmm.
And the reality is, you made more money running a
Hmm.
practice than you did seeing patients. And
True.
after about 4 or 5 years, it just wasn't fun. I was getting up every morning and not wanting to go to work. So
Hmm.
going back to practicing medicine and just working for somebody
Hmm.
became a tremendous burden off my shoulders.
Hmm.
I can go in, I see patients, I write my notes, I go home, I'm done. Now, having said
Hmm.
that, I do get phone calls and all the things you have to do in medicine. I have to talk to
Hmm.
families. I do geriatrics, so I have to talk to children of
Hmm.
my patients. I have to talk to the nurses, the staff at the facility which I work. Um, but I don't have that second job. So I get finished seeing patients and I'm finished. It feels like it's
Hmm.
easy. So
Hmm.
the transition from that was very easy for me to leave that behind. What was very difficult for me, and still to this day is very difficult, is I had medical students and postgraduate medical residents with me on the East Coast virtually all the time, every minute of every day almost. And I don't have that here. And I
True.
miss that. I miss having those younger people with me because they have new ideas and they push me further to do the right thing. And so I miss the teaching, but in life, apparently, you don't get everything.
So, how was the teaching experience? Because you had been doing that for quite such a long period of time. So, how was the teaching experience? As you mentioned that being around with younger people, we just the thing enthusiasm just pours out and we feel good and we get new ideas because this new generation brings in some new ideas also. So how was your personal experience in the teaching field, and how are international medical graduates, they must be there around you huge amount, and many international medical graduates are our viewers. So what was your personal experience?
I taught residents from the time I was a resident, my first day in practice in 1977, until leaving Philadelphia, the East Coast, in 2014. Um, I think that 98% of it, I really enjoyed having the people around me talking about medicine, talking about life, talking about the things I did, analyzing medicine. I would always say it's not what you think about what you're doing, it's what your patients and others think about what you're doing. You can't be your judge. You may think you did the right thing, but it doesn't matter what you think. It matters what your
Mhm.
patient thinks, what the others around you or judge you.
Hmm.
You can fail miserably. You can make a mistake,
Hmm.
and if you do the right thing at that time and you do it honestly,
Hmm.
you'll find out that other people respect that and they're not going to get upset with it. What I'm saying is that when somebody has a pain, you may admit them to the hospital, you may not admit them to the hospital. You make a decision and it's not
Hmm.
100%.
Hmm.
And you make that decision, and when you make it wrong, people are not happy. Okay. So
mm,
if you make a decision to send somebody to the hospital because you think he may have had a heart attack and he
mm,
hasn't had a heart attack, he
mm,
says, why did you send me to the hospital? You ruined my day. Okay. You
mm,
destroyed my day. On the other hand,
mm,
if you don't send them to the hospital and they have a heart attack at home,
mm,
that's bad. And then they get upset with that. But
mm,
when you can do the right thing and process,
mm,
then people will respect that. And when you have the younger people around you, younger people in medical school when I was there, and certainly today, look at the studies and they look at all the things that happen. But
mm,
sometimes we forget about patients. Sometimes we go and we look at an MRI, we look at a CAT scan, we look at an X ray, we look at an ultrasound. But where do you take that person and go in and see the person and talk to that human being as a person and find out what that person wants?
mm,
And so I've always tried to be somewhat humanistic in that because the
mm,
feedback that you get from your
mm.
patients and then from the residents, the students, becomes really just beautiful
Yes.
when your students tell you you did a good job, when your when your patients tell you you did a good job. Um, wow, it just makes your day. It's not your day, your week, your month. Um,
Yes.
I back in 1996, I won an award at the university for the outstanding professor. The entire
Mm,
220 person class voted me their outstanding professor. And I went to their class day, their graduation day, 1996, 25 years ago. I
mm,
remember that like it was yesterday. That was somebody saying to me over the course of time, not one day, but over the course of the 4 years of study, I'm the one person that they remember as having been
mm,
their outstanding professor and hundreds or thousands. So education is just, it's part of it. Education in medicine is so important because medicine changes. We don't have to go back but more
mm.
than 14 months and tell you that I never heard of COVID 14 months ago. There is
Yes.
nobody in this world today who hasn't heard of COVID.
Mm.
14, 15 months ago, never heard
No
of it.
one. Yes.
Had to learn what it was, how to deal with it, how to treat my patients with it, how to prevent it, both clinically and from a public health standpoint. I learned so much and have grown so much in this 14 months. And yet, 50 years out of medical school, and there's still more to learn. Yeah, that's true. That
That's
is
true.
true. You never
Yes.
get to say, I graduated, I'm now a doctor, I'm done learning. I can now go out and practice. You can't. You can
You
never
are
stop,
yes. You are a lifelong student if you are in medicine.
for
You have
sure.
to be a lifelong student because, and on top of it, every case also teaches you something new. Maybe how to deal with, how to talk to. So, Doctor, coming back to the resident doctors out there, what is that one skill set which you feel that they should have? It's very important and they should have. What would that one skill be if I ask you to name one?
um, the first one, and I've taught a lot of people who have come to me from countries other than the United States. Um, it sounds a little bit silly, but not. The most important skill set is language, is
Language.
communication. Um,
Hmm.
when I speak to you, I can understand 99% of what you're saying. I don't think I
Hmm.
ever understand 100% of what anybody says. So you can speak English so I can understand it. It's not me saying you need to speak my language, but rather
Hmm.
you need to be able to coordinate with your patients, with your
Hmm.
nurses, with everybody else. And then not only people from the United States, but you're going to, if you come here, you're going to have people from The South Asian countries. You're going to have people from Japan. You're going to have people from China. You're going to have people from Israel. You're going to have people from Spanish-speaking countries. You're going to have people from all over the world that you're going to have to interact with. And we all need to speak the same language so that we can communicate with each other. And more importantly, with your patients. Your patients, if
Yes.
you're coming to the United States, the overwhelming majority are not going to speak anything but English. And you've got to be able to coordinate and talk to them. If you can't talk with them, you can't,
Hmm.
all your skill sets
Hmm.
become unimportant. Your knowledge of medicine, your knowledge of pharmacy, your knowledge of physiology, they become unimportant because you can't communicate with that other human being. And so, I, that's the one that I would say is most important. I can't imagine how hard it is to learn how to practice medicine and learn it in a language other than the one that is your native
Hmm.
primary language. I have nothing but respect for everybody who does that. I consider myself somewhat ignorant because I can only speak one language. I've never learned that second skill set, and I can't imagine how hard it is. Yet, I know how important it is.
It's very important because you will not understand what the patient is trying to say. Sometimes there is, yes, non-verbal communication, so communication skill also plays a very important role. He may be that he is not able to express it in words, but he is putting forth to you what he feels, or where does it pain, or something like that. So you should be able to read that also. So the communication skills, that means language as well as verbal and non-verbal both, it's very very important in the field of medicine. So it's not only as I can understand from you, it's not only that you must understand the medical knowledge or you must be good at it, you must be a gold medalist, but it's very important to have good communication skills also.
Yes, I think that's so true in clinical medicine. Now, having said that, you could become a radiologist who doesn't work as much with people. You could become a
Hmm.
pathologist who does autopsies. And when you do autopsies
Hmm.
on dead people, while they speak to you by what you see, they don't talk to you. So that's a
Yes.
whole different skill set, and I'm not going to comment on either of those
Hmm.
two because I'm not a
Hmm.
radiologist and I'm not a pathologist. However, there are
Pathologist.
areas within medicine where if you don't like working with people who are alive,
Hmm.
you can
Hmm.
find things to do. You can run a medical lab. The
Hmm.
I think there are things you can do there which are very, very valuable, and I rely on my
Hmm.
colleagues in radiology,
Hmm.
pathology,
Hmm.
who run
Hmm.
labs, etc. But it's not what I want to do. I rely on my
Yeah.
colleagues who are scientists who are doing tremendous research. I
Hmm.
rely on those scientists and physicians who devised ways within a year to get a vaccine to combat COVID. I don't
Hmm.
have the skill set to
Hmm.
do that, but I have a lot of respect for whoever put that stuff in my arms. Okay. So they're
Yes.
important, but that's just not my part of what I do.
So, doctor, it's important to understand what you're meant for, what your passion is. So, do you think that shadowing or volunteering before even you enter into the field of medicine will help you out? And what is that again? That point in your life when you are doing your MDs, etc. To which branch of residency should you take? Like you said that you are a people's person, someone, if he is not, he may go to either pathology or radiology, some sort of other disciplines. But how to choose that? And are people wiser enough to choose that, or how does it work?
Most people are wise enough to choose it. You have to remember that if you're going into medicine, it's going to consume your life. It will involve you. It will take your whole body and soul with you. If
Hmm.
you're going to get up every day and go to a job, don't go into medicine. Medicine can't be a job. Now, it's not all, every day isn't perfect. There are bad days, but you
Hmm.
have to realize that this is what you want to do, not something that you have to do to have a job. You want a job, Go into software. You'll make more money. You'll get your time off. You'll get your 2 weeks vacation. Go into medicine, it will consume you. And so I think that shadowing helps to see what happens. That's not the whole end of the picture. Go into something that truly makes you feel good about what you do. And if it doesn't, go do something else. I've had medical students. I had a medical student who spent a week with me in my office every day, 40 hours for that week. And in the midst of, very nice young man, and in the midst of what we were talking about, I asked him what he was interested in doing. And he said, I'm going to business school and I'm going to Wall Street and I'm going to be a venture capitalist. And I said, why are you in medical school? And he said, because I got into medical school and decided to go, but it's not what I want to do. I'm going to get my degree. I'm going to go out. I'm going to go into business and I'm going to work on Wall Street and buy and sell businesses.
Yeah.
He probably is the richest person I've ever taught. That's okay.
That's okay.
And I said to him, well, good for you, because you know now what you want to do. So sometimes you don't find out before you get into medical school. The nice thing is, once you get into medical school and once you get through medical school, there is almost nothing that you cannot do. Okay. You can go back and get a master's in business. You can go back and get a PhD and be a researcher. You can, and there are 2 or 3 senators or congressmen now in the United States who are physicians.
Yeah.
You can go into politics. You can become president if you want. I'm not sure why anybody wants to do that, but that's a whole different issue. And so it gives you entree in how to think and how to problem solve. So you don't have to make up that decision before you go to medical school. But when it comes time to what you want to do in medicine, do something you really enjoy doing every day, because if you don't really enjoy it, you are going to hate it.
True. You're going to hate it. That's a very important statement. And if you hate your job, then as you said, you now start doing medicine as your job, and medicine is not a job. It is going to consume you up. So that was a great insight, Doc. Tell us something about your childhood. We have tracked your journey after your high school. How was your mother like, and what were her teachings, which you still remember?
Well, my family, I guess everybody thinks their family was unusual. My family, my mom and my dad, both were lawyers, not doctors. They were both lawyers. And my mom, I have to say, she became a lawyer in 1947. All right.
Okay.
And if we go back, that's 75 years. There were virtually no women who were lawyers at that time, or doctors for that matter. Life was different here. In her class of several hundred people, there were 2 women. So she was an independent person. And she always taught me to be independent. She always taught me and said, you have to do the right thing. Whatever it is, do the right thing. It didn't matter what the costs were. You do the right thing when it comes up. And later on, things work out. When you do the right thing, the wrong thing, things pile up and eventually they collapse. So in medicine, if you don't do the right thing, I can guarantee you down the road, it's not going to work out for your patient. And when it doesn't work out for your patient, it doesn't work out for you. So when I have one of my key advisors being an attorney and I'm a physician, I don't worry about that, but it is what it is. And I do remember that, so she was very encouraging for me to go into medicine. I think that she was very happy that I became a doctor. My
Hmm.
father wasn't as enthusiastic about medicine. He wasn't sure that's what I wanted to do.
Okay. Hmm. Hmm.
And my mom she was always there for that.
Hmm. 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 Okay. So that was, and you had any siblings,
Pardon me?
or you were on? You had any siblings, or you were an
I
only
do.
child?
I have two sisters. One of whom is speech pathologist, and the other one was a reporter, a newspaper reporter, who,
Hmm.
uh, when she was midlife, decided that that's not what she wanted to do, and she went back and became an English teacher and taught for 20, 25 years.
Okay.
And one of the big benefits I had in moving out to California was, for whatever reason, we were all born on the East Coast. They had
Hmm.
moved to California 20 years before. So not only were my grandchildren here, but my two sisters were within an hour from me,
Hmm. 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 Hmm.
which was really nice. So,
Yes.
I guess I keep talking about family and medicine. Medicine can take your soul. And you have to remember that at the end of time, at the end of life, at the end of you're very lucky if you have
Yes.
one person with you at the
Hmm.
end. If you have your family with you, a child, two children, grandchildren,
Hmm.
sibling, then your whole life is full. That's the measure. The measure isn't how much you've done, how much money you have in the bank, all those pictures on the walls. The measure is who's with you in the end, what's important. And if you forget that, you
Hmm.
forget that we're all human beings, and that caring one for another is what's important. It's what's missing in COVID, the touching, the interaction with human beings that we just don't have like we had 14 months ago. Um,
Yes.
I can't wait for this to go away. COVID, I'm talking about, not
True,
medicine.
true. No, no. How can medicine go as the savior?
Well,
So,
medicine could go for me. 50 years in medicine, more than half of my classmates are retired. Um,
oh,
I'm not retired. I can't imagine getting up every day and not seeing people, not taking care of
hmm,
people, not
hmm,
interacting
hmm,
with people on that level.
hmm,
Um,
hmm,
Now that I don't have, and you asked me this before, now that I don't
hmm,
have the business responsibility,
hmm,
um, it's just so much fun again just to see
hmm,
people. Now, that doesn't mean some people don't upset me, because human beings can upset each other. But having said that, overall, it's 90% good. And in this case, 90% good is good. You don't need
good.
95% in this one.
True. So, coming to the present practice which you are doing, doc, that is the geriatric branch which you have, which you are practicing here right now. So, the wisdom which you just shared with us is very often or more often true with these people whom you are treating right now. So, on a daily basis, you must be there must be a moment in your life when you must be thinking, oh, it's so very important. This is why it's so very important to have families with you. You must be seeing people around you who don't have children, or who are not looking after them, or something like that. So on a daily basis you must be realizing how important it is to be with your family, emotionally, for your mental well-being. Because the nursing home in which you are doing, we will like to understand more about it, what it is like you are doing right now.
Yeah, the nursing home that I work in, which we had 150 people before COVID, we now have less, unfortunately. Um, Not all dying from COVID, dying from diseases that people get. The nursing
Mhm.
home that I work in has not only physical and aging problems, but also serious and severe psychiatric problems.
Okay.
Probably a third to a half of the people I take care of have been homeless, living on the street, and
Mm-hmm.
have no family who cares about them, no family who wants to interact with them. I had the experience of calling uh, somebody's family and saying, because she was listed, and saying your mom has an abscess and we have to um, open up the abscess. We have to
Hmm.
incise it.
Hmm. Yeah.
And her daughter said, I thought my mother died 5 years ago. Just
Oh,
had nothing to do with her. These people,
okay.
many of them are very severely schizophrenic. And so they're
Mm-hmm.
very difficult for families to deal with. So I don't criticize families for not having to do with them. But then it
Hmm.
becomes my job even more so to interact with these people, not only on the medical level, but on the um, uh, almost a governmental level, permission level, whereas I can say to a patient, would you like to have this done? And they'll respond to me. Schizophrenic people, people with Alzheimer's, although I've less of those now than I had before, can't do that. So you've got to go the extra road to really make sure that what you're doing is right.
Hmm.
You've got to make decisions with whether or not to do CPR without family input, without the patient
Yeah.
input. And you've got
Hmm.
to make that decision with social workers, sometimes judges,
Hmm.
attorneys get involved, and it becomes very rewarding when it works out well, and very frustrating because
It doesn't.
you sort of know the right thing to do, and sometimes you can't get there. There's no road to get there.
Hmm.
But overall, in that situation, the facility I work in, we have people who have worked there for 40 years. So they're very dedicated. It's not a facility that is a rich facility that you get paid a lot of money for. You get paid very little. I'm not talking about me. I'm talking about
Hmm.
the staff. I don't care
Hmm.
at this point, what I get paid doesn't matter. But for the
Hmm.
rest of the staff who have been there, it does. And they're there not for the money, but because they really want to take care of these people. These people, many of them are the forgotten people of the world. They're the people who are street people who, when you
Hmm.
walk down the street and you see somebody living on the street, you just
Hmm.
want to walk by and get away from them as fast as you can.
Hmm. Hmm.
And
Hmm.
yet they're human beings. And these are many times the people that I take care of um, with my staff. There's in this facility, there is no other doctor at this facility. I am the doctor. They can't get another doctor, or doctors don't want to work there. Whatever the reason, the last year and a half, I am the only doctor at this facility, which um, I kind of like because I love the staff. They have great staff, great people,
Hmm.
um, and that's the good news. The bad news
Yeah.
is I'm on call 24/7, 365.
Oh. Oh. Oh.
So no
Oh.
matter where I am, no matter what happens, I am the only doctor. So if there's a
Hmm.
problem, they call me. So I've been in taking trips just for myself to Australia, to Japan,
Hmm.
to China over the past 5 years, Mexico. I get phone
Hmm.
calls in Australia, China, Japan, and yet my cell phone is ringing. So thank God for cell phones. But on the other hand, uh, but it's what I do. I've gotten used to that.
Hmm.
It doesn't seem to bother me. It used to when I was young. It doesn't bother me
Hmm.
now for some reason. I don't know why, but it just doesn't bother me anymore.
Yeah, and the big credit goes to your better half
Yeah. Oh,
because
well, yeah. I
she
mean,
is traveling with you and you are on a vacation and you are continuously getting phone calls. So she must be cribbing. If I was in her place, what I would have said, I was just thinking, oh my God,
yeah,
every time, not even on vacation. So, yes, a big
yeah.
credit goes to her.
Yeah. I mean, yes, yes. I get. With COVID, we haven't gone anywhere in a year now, and that's unusual for us. And my wife said, when we go away, you have to figure out a way they're not going to call you. I don't want to get all the phone calls away. So
Yes, yes.
life isn't always what I want. Life's a bit of a compromise, and
Mhm.
I think it's very difficult on her. I think it's perhaps more difficult on her than it is for me because I have the excitement. When that phone
Mm,
rings, it's exciting. There's somebody on the other
mm,
end of the phone who needs my help. So that's
mm.
exciting. That's good. That's
Yeah,
excitement is
yes.
good. When the phone
Mhm.
rings for her, it's just an interruption, either of her sleep or what she's doing. So it's much
Yes.
more difficult, I think, for your significant other to deal with a life in medicine than it is for you. You always have excitement. I can always get
Mm,
up and go to the hospital and there's something exciting going on
mm,
24/7.
mhm.
Not so for everybody around me. So
Yes.
I've been blessed to have a partner in life like that. I don't know what I would have done had I not been with her. I just don't know. I just can't imagine what life would be like. So hopefully I'll
Probably
never
you,
have.
probably you have maintained your work-life balance quite well, and so it works. So yes. So what was that moment in your life, Doc? Any one or two moments which you can say where you got tremendous satisfaction while dealing any case in medicine or anything like that, but it was very, very satisfying and it made your day or it made your life, as you already have shared one moment. But apart from that, in the field of medicine, I would like to hear any incidents.
Within the field of medicine,
Yes.
you know, um, it's when somebody. It's come to me to be when somebody dies. Okay, because when they die is obviously a crucial time for um, staff, for people other than um, people remaining, children, um,
Yes.
and it's
Hmm.
how you handled it. It's what you do thereafter. So the payment for that to me becomes when the family comes back to you and says, you did the right thing. Mom died, but you did the right thing. And you'd be surprised when you reach out to people. I had one case late last year, December of 2020, and I had a 90 plus or minus 90-year-old woman who had a number of problems living alone in a retirement community.
Hmm.
And daughter called me and said, Mom's not doing well. And I saw her by Zoom because we were doing Zoom visits.
Mm,
And
yeah.
I had some lab work done. And I said, I think that she has a bloodstream cancer, but I'm not an expert in that area. I don't know if that's what she has. But in order to find out what she has, we would have to send her to the hospital. We'd have to give her transfusions. We'd have to give her IVs. But she has underlying Alzheimer's disease and she's not happy. And if she had that, then we would have to put her through chemotherapy or radiation.
Hmm.
Is this where we want to go? And this daughter said, let me talk to my siblings, and got back to me, and we decided to put her in hospice. And this woman died. And she sent me an email, and I'm going to read you that. I just pulled it up now. This is
Hmm.
dated Christmas Day, December 25th. I wanted to make sure that you heard that my mom passed last night. We had talked to the hospice nurse around 2:30 yesterday, and he said, "Come see her as mom's passing was imminent." We went right away to see her. We saw the aide there. Last night, mom died. We're so grateful that the process was not long and drawn out, and that my mom was comfortable. I wanted to thank you so much for your help and care of my mom. I really appreciated your taking the time to explain to me what was going on each step of the way and keeping me included. So thank
Hmm.
you from the bottom bottom of my heart, I know that my family feels the same way. To
Oh,
me,
my.
now
Yeah.
that's 2 months ago now. And that
Hmm.
happens when you do the right thing. Okay. I just pulled that up because that's what happens. People sit and they think about it. You know, I was in a restaurant and a lady came over to me and said, "Oh, you're Dr. Silver. You took care of my mother." I said, "Oh yeah, I remember your mother." You know, told me her name. I said, "Oh, I remember your mother. She's about 4 foot tall, and she'd always come into my office, and she'd always, you know, we'd talk about this or that. And we'd talk about it." And she said, "You know, you wrote me a letter, and
Oh.
it summarized my mother, and I just wanted to say
Hmm.
thank you for all these years." I said, "Well, I remember your mom, but I don't remember when she
Hmm.
died." And she said she died 12 years ago. And I have
Oh.
your letter framed, and I look at it all
Hmm.
the time, and not a day goes by that I don't think about you and your care and how you captured what she said when you wrote me that letter. I just want to thank you. So this happens when you do the right thing. So did I save this woman's life? Not even close. But in geriatrics, you have to realize that nobody gets out of life alive, that at the end of life, we all die. And there's comfort in death as well. Death doesn't have to be horrible. Um, you want to help with that. So I think that the moments in my life when this happens is just so great, and I carry this in my heart as a positive. And I think these letters and these things are the reasons that I can't quit medicine. I'm old enough to quit, and
True.
yet and
Very
yet
true.
and yet when I see that I'm still able to do this good for people, and
Hmm.
these letters tell me I'm doing the right thing. I'm not the judge of whether I'm doing the right thing. I may think I'm
Yes.
doing the right thing every day, but when
Hmm.
somebody's relative, daughter,
Hmm.
friend writes me a
Hmm.
letter, calls me on the phone to say thank you after their loved one died because you did everything that you could and you left a good feeling and you gave them comfort. Wow.
Hmm.
I mean, that's where that's I think that's the addiction. That's my addiction that I really am doing some good for people, and that goodness that flows back to me sustains me and makes me go forward.
True. 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 So you must be a satisfied person when you hear all that, and you must be remembering your mom too. That she always said that do the right thing no matter what. So you had been doing the right thing, and therefore you are satisfied. So, Doc, last but not the least question towards the end of our interview. What advice would you give to your 20-year-old self?
Do it all again. Just do it all again. Um, you know, I can't think of very much um, that I would change personally, professionally in my life. Big decisions, biggest decision of my life, which was the easiest decision of my life, was getting married.
Okay.
That was the easiest decision I've ever made, and
Hmm.
yet that was the biggest decision. Having children, second biggest decision. Once you
Hmm.
have children, you can't put them back. You know, you can go to
Hmm.
medical
Yeah.
school. You can go to medical school and decide you don't want to be a doctor and go
Hmm.
to law school or go to business school.
Hmm.
But
Hmm.
once you're a dad and you have children, they're
Hmm.
yours forever. You can't put them
Yes.
back. You know,
You
that's
cannot reverse the wheels.
children is irreversible. Business decisions reversible. Medicine
Yes.
reversible. Children not
Not.
reversible. Okay, grandchildren reversible. You can give them back to their mom and dad. Which is why you love grandchildren. But internal medicine, which is what I've done, and geriatrics. You know, I went into geriatrics for all the wrong reasons. I went there because I had finished my residency. I had 2 children and I had to make some money and thought I could make some money to support my kids. Turned out I loved it. I didn't go there because I thought I liked old people.
Okay.
I didn't think I liked old people. I found out I did. But geriatrics, the teaching, all that, really positive. Running my own business for 20 years, loved it, loved giving it up, loved doing it. And then I knew when it was time to quit. Being on the East Coast, I was born and raised in Philadelphia, stayed there for 63 years, and 63 years moved to a whole new place, 3,000 miles away. Knew my kids and didn't know anybody else. Had to start all over again at 63. I would do that again. That was great.
Yeah.
Professionally, it was great because nobody here knew me. So I had to prove myself all over again in my mid-60s because people would say, well, yeah, he's coming out here. He's 63 years old. He probably doesn't know what he's doing. So I had to prove myself all over again. And I would do that. I I really can't think of.
I can understand. You simply love what you do, and it's exciting for you too. And therefore, it's great to have you here, Doc, today because the children out there who are still planning to enter into this field, they must have got tremendous insights from what you told them today. Basically, how the functioning is in United States, how it works, what to do, and most importantly, what not to do. You must understand that this is not my calling. Better late than never. But yes, you have to understand that it's not my calling anymore. So I must switch. But simply pulling on because you're getting something, getting money doesn't make any sense, at least in the field of medicine.
Yeah, embrace it. Yeah, you should embrace it. You should love it. Medicine is not a profession. It's a calling. It's what you want to do. That sounds silly, but you need to embrace it. You need to love it. I told my 10-year-old grandson on this past Saturday, if you want to go to medical school, if you want to be a doctor, do it if you love it. But it's going to be your whole life. You have to love it. You can't just like it. You have to love it. And if you do it. Do it all in. But if you don't, go do something else. That's what I told my own grandson. If you love it, do it. But if you don't truly love it, go do something else. You can't just like it a little bit. Oh yeah, this might be a good thing to do. No, you gotta love it. At the end of your life, you have to love it. You have to love getting up every day and working with it. And I'm not going to tell you that every day is perfect, that I don't get frustrated with one patient, two patients, or some relatives. I do. People can be frustrated, but and some you can never solve the answer. Some people you can never get to it there. But overall, it's 90% good. And if you have a profession that's 90% good, that's pretty good.
That's pretty good. Okay, doctor. So thank you very much for coming to the show and giving us tremendous insights into the field of medicine.
Okay, and good luck to everybody.
Thank you. Thank you, Doc.
Bye now.
Bye-bye.